What is Parkinson's prodromal phase? Imagine noticing strange signs in yourself or a loved one that seem minor but could be early clues of something more serious. That's what the prodromal phase of Parkinson's disease is all about. It is an early stage where subtle symptoms appear, but they do not yet meet the criteria for a full diagnosis of Parkinson's. This phase can last for many years, sometimes even 10 to 20 years, before the classic motor symptoms like tremors, stiffness, or slow movements show up. During this early period, most symptoms are non-motor, meaning they are not related to movement but can still greatly affect quality of life. One of the most common signs is a reduced sense of smell, called hyposmia. This can happen up to 2 decades before motor symptoms and occurs because of early changes in the part of the brain responsible for smell. Constipation is another early sign, often appearing years before movement problems, because of early involvement of the autonomic nervous system, which controls automatic body functions. People might also experience REM sleep behavior disorder, or RBD, where they physically act out their dreams during sleep. RBD is considered a strong and specific marker for Parkinson's, with about 80% of people with this sleep disorder eventually developing the disease. Mood changes like depression or anxiety can also show up during this phase, along with signs of autonomic dysfunction, such as blood pressure drops when standing, frequent urination, or erectile difficulties. The underlying cause of these symptoms is early Lewy body pathology, which affects parts of the nervous system involved in smell, digestion, and automatic functions before spreading to areas that control movement. Because many of these early signs are common in the general population, diagnosing Parkinson's in this stage is challenging. No single symptom can confirm prodromal Parkinson's, but a combination of risk factors and markers can help estimate the likelihood. REM sleep behavior disorder on its own is currently the strongest indicator of prodromal Parkinson's. Recognizing this early phase is important because it opens up possibilities for early intervention and research into treatments that might slow or prevent the progression to motor symptoms. However, at present, prodromal Parkinson's remains mainly a research concept rather than a formal diagnosis used in everyday clinical practice. In summary, the prodromal phase of Parkinson's disease is a long period marked mainly by non-motor symptoms that appear years before the classic movement problems. Understanding and detecting these signs early could someday lead to better ways to manage or even prevent the full development of Parkinson's. If you notice any of these early signs, it is always best to consult a healthcare professional for personalized advice and assessment.